So I appreciate you guys wearing masks. I'm going to take mine off so it's a little easier for you to hear me. And I do appreciate you guys keeping kind of your distance.
Yeah, do we need to move up closer?
I can stand up further if that is that better?
Yeah, that works.
Okay. All right. Good afternoon. Before I start, I wanted to take the opportunity to thank AMI, the county emergency management officials, Senator Schwank, for welcoming us to Berks County and for all of their work here on behalf of the constituents. As many of you know, AMI has worked tirelessly alongside the Department of Health for over a year to provide efficient, accessible, and accurate tests to Pennsylvanians. And this site is just one of 6 that they are currently operating across the Commonwealth. For me and our team at the Department of Health, this effort represents just one of the many ways we have worked hard to make COVID-19 testing available, accessible, and adaptable as Pennsylvanians continue to prioritize their health and the health of their families and friends. In addition to what you see here, we're working with thousands of locations across our state, including testing centers, hospitals, health systems, private healthcare providers, pharmacies, and schools. We understand that there's an increased demand for testing due to the holiday season as COVID-19 case counts continue to be high across the Commonwealth, and many people are planning holiday gatherings and travel. We appreciate and are proud of the Pennsylvanians who step up to get tested if they experience symptoms or when they've been exposed. The Department of Health is committed to this effort, and we recognize that when it comes to fighting COVID-19, we still have a long way to go. Fortunately, there is something we can all do to protect ourselves and our loved ones. We can get vaccinated and get a booster dose. If you have children 5 and older, they can get vaccinated. For teens and adults, they can get their first, second, or booster doses today. On average, we're seeing nearly 43,000 Pennsylvanians a day stepping up to get vaccinated. Many of those people are getting a booster dose. In fact, just over 33% of adults in Pennsylvania have gotten their booster dose. But we need everybody to step up. Many people eligible to receive a booster dose still need to receive their extra shot to maximize their protection against the Omicron variant. It is important to note that this virus is evolving, and we need to adapt and follow the science to stay ahead of it. It's no longer sufficient to be fully vaccinated. We need every eligible individual to get your booster dose to maximize protection for you and your loved ones. Before I close, I want to thank everyone who has already been vaccinated and those who are getting tested to protect themselves and their loved ones. You all are being leaders in the fight against COVID-19. Your commitment to health and safety by getting vaccinated and following public health safety guidelines is making Pennsylvania a better place to live, work, and play. Thank you. I'm happy to take your questions, guys.
Secretary, can you talk about today's numbers with the new single-day count, I believe a record, and also how that fits into what we're seeing with the strike team deployment in your strand?
Sure. So it's important to keep in mind that the last 7-day moving average was just shy of 10,000. I think it was 997 cases a day. Today we did see a 1-day shift to just over 17,000 cases. We do anticipate that there will be case counts that continue to rise, but we're going to remain focused on the trends and not get too wrapped up in one day.
Secretary, how long do you anticipate you'll see these elevated levels right now? And is the state discussing any potential mandates or anything going into effect?
So we do anticipate that case counts will continue to remain high for the foreseeable future. That's why it is really important that people get vaccinated, they mask regardless of their vaccination status, because we are in a community of high transmission, that they socially distance, wash their hands, and get tested like the folks that are doing here today at this AMI site. We're not currently considering any mitigation activities, but we are counting on Pennsylvanians to do the right thing, take care of themselves and their loved ones.
We're hearing from a lot of people who say they're symptomatic or they've had an exposure and they can't get a test, whether it's an appointment, a drive-up, whatever. They can't find anything to do that's antigen, whatever. My question to you is the state planning to expand any opportunities? Will we see more sites? And when you look at the demand out here, I mean, who should be getting tested? Are there people who are coming in who really don't need to be getting tested right now?
Sure. So we do encourage anybody who is symptomatic to get tested. Hopefully it's just a mild cold for you, but it is important to know if you are COVID positive so that you can properly isolate, or if you have been exposed to someone, we do encourage you to get tested so you can appropriately quarantine. Right now, the department has really been focused on providing testing for the most vulnerable. So those include folks in our long-term care facilities, our schools, our prisons, and the like. We do really appreciate the efforts of folks like AMI to also bring testing directly to the community, which is why starting next week we are going to be expanding our community-based testing sites. We'll have an additional one in the southeast, and we're working with the counties now in order to finalize that location, and as soon as we have more details, we'll provide them publicly.
Anything in South Central PA, just for our viewers?
There will be one in the southeast, and then we are looking to expand existing contracts with testing resources to have more geographical presence across the Commonwealth.
How long will this one stay?
So the AMI testing sites do tend to rotate between 1 to 3 weeks at a time. We got a request from Berks today to extend the testing site longer, and we're doing our best to be able to accommodate that.
That would be appreciated. Thank you.
You bet, Senator.
When will you know whenever you extend
I'm sorry, I can't quite hear you.
it? When will you know that this site has been extended?
Oh, early next week. So we determine where we put our testing sites based on cases per 100,000. So we are always looking to deploy the sites in places that have the greatest need and are the most resource constrained. So we will certainly be providing additional capability in the southeast. And we look forward to continuing to work with the county to make sure that this location is the good fit for the community.
If the feds are going to be sending any additional test kits, have you guys asked for those? I know the Biden administration said that they were planning on trying to make that more available.
We've not received notice that we'll be getting more testing resources from the Biden administration at this time, but we do look forward to the 500 million at-home tests that they said they've purchased, and that Pennsylvanians will be able to order directly from a federal website, hopefully starting in January.
How do you plan to track positive cases now that people can go and buy these at-home tests and not have to go to a clinical setting?
Yeah, it's a great question. So we are still receiving on average about 73,000 test results a week. I think even in the last couple of days that's been a bit higher. Our highest 7-day moving average ever was about 80,000 tests a day. So that does give us a sense of the prevalence of the disease in the community. And I think that's really one of the core, there's 5 main reasons that you test. One of which is, to diagnose people who are symptomatic. Second is to determine the appropriate clinical care and so on. And one of them is to track the disease in the community. And so with 80,000 test results a week coming in, we do have a good sense of where the disease is prevalent within the community. And from a public health perspective, that's sufficient data.
The state's seen a high number of COVID deaths reported today.
Yeah.
Just how many of those people were vaccinated versus unvaccinated? Do you have that data?
I don't have today's data for today's death count of who was vaccinated and unvaccinated. We know in general the vast majority of people who die from COVID-19 are unvaccinated. But Barry can follow up with any other specifics you have.
The White House said today, I believe, that there's going to be some kind of federal site in Philadelphia. Is that going to be a testing site? And do you have any idea about when and where that's going to be located?
So Philadelphia Department of Health is working directly with PEMA to work with FEMA in order to bring that testing capability to Philadelphia. I would refer you to Philadelphia Department of Health for further questions.
What's the turnaround time for a test? If somebody came from here, how quickly will they be able to do that?
I believe test results here are within 24 hours.
Is that enough, given that Omicron is supposed to move faster through somebody's system and will spread? Is that much faster? Is that what
Yeah, 24 hours is, I would say, an industry best practice. And so we do encourage people while they're waiting for those test results to quarantine to the extent possible, and definitely wear a mask when you're in public.
Do you have any idea, like from a general standpoint, like what we're looking at as far as hospitalization concerned are you about that? And then, again, I know you were talking about case numbers.
Yeah.
Individual positive tests may not be a big focus anymore. It's hospitalizations. Can you talk about where we stand in pediatric wise?
Sure. We have about 18% of pediatric ICU beds available in the state right now. The acute care capacity is roughly the same. So our pediatric capacity is quite limited at this time. That's why we're really encouraging folks to get kiddos vaccinated as quickly as possible and to continue wearing a mask when you're in public.
As of today, where do things stand with the Omicron variant here in Pennsylvania? And have you had any Omicron deaths yet that you know of?
Omicron is spreading in Pennsylvania just like it is all across the nation. We do not have any known Omicron deaths in Pennsylvania at this time.
I think the bottom line I'm kind of getting from you is that we are seeing high case counts, but you're really more worried about the hospitalization. Can you talk a little bit more about that strategy going forward, especially now that we have these strike teams going to New York for purposes?
Sure. So there is a lag between cases and hospitalizations. So right now we're seeing a little over 4,600 people hospitalized with COVID-19. That makes up roughly 21% of total hospital capacity in Pennsylvania. Hospitals are operating at one of their highest points of utilization at any point in the pandemic in total. And so the piece around cases that's important to keep in mind is that cases do result in additional hospitalizations a couple of weeks later. So where the department has been focused is working collaboratively with the entire healthcare community, with the legislature, and with partners such as HAP, in order to decrease the number of people showing up at the hospital, increase the number of people being discharged from the hospital, and then shoring up the hospital with the resources that they need. And so we are excited that there are 2 strike teams coming to Pennsylvania from the federal government. One is going to WellSpan York, the other to Scranton Regional. In total, they will bring online less than 30 acute care beds. So while we are grateful for the support from the federal government, it is not sufficient to help us really curb the challenges that we're facing right now in the acute care space. And that's why we need every Pennsylvanian to do their part and get vaccinated, wear a mask in public, and get tested if you're not feeling good.
Just to be clear, as far as expanding testing, are we going to see more sites? Should we expect that there may be more sites like this being planned in other parts of the state? I think you said southeast Pennsylvania, but it sounds like you want to expand that geographically.
We do.
But this site is, to be clear, this site is closing today, and it's unclear whether it will reopen.
No,
It's understood that then.
Yeah, it's not closing today, but they are at capacity for today by way of the number of tests that they can do. So this site will be open until the first week of January, and then we're assessing if we can extend it longer, given the clear demand that we're seeing in the Berks community.
So that'll be through the first week, so Friday in January.
I'd have to double check on the exact date for you, Senator, but we can follow up with you on that.
Calls in our office.
Yeah.
We're unable to get tested at pharmacies and long waits, so they want to.
Absolutely. Yeah.
Has the vaccine task force shared any ideas with you about testing and were you able to share anything what was discussed?
The last time we met with the vaccine task force was a couple of weeks ago. We provided them with a broad overview of kind of what's happening in the Commonwealth, but our work with them does remain focused on vaccines, which is as important now as ever, so that we decrease the overall case count.
You talked about the demand you're seeing here in Berks. Just how do case counts here compared to other parts of Pennsylvania?
We're seeing the greatest surge really in the south central and northeast right now, but we are seeing rapid increases in all parts of the state.
Will that have an increased capacity going forward for places like this?
The maximum number of tests any of the AMI is 450. So some of the sites that we're going to be setting up will actually be closer to 300 tests per day. We're doing that so that we can maximize the resources. Not all of the testing sites are quite this busy. And so we want to provide adequate supply for the demand that we're seeing in different communities, but then shift that supply so that we get broader geographic coverage with community-based testing sites.
And you just recommend people come back tomorrow at the early morning kind of thing?
Certainly.
Or whenever their next open?
Yep, absolutely.
So are you quantify how you keep increasing
So there are 2 AMI sites that are not at capacity right now. So we will scale those 2 sites down to 300 a day, and then we will take the staff that are no longer needed there and redeploy them at a site in Delaware County that will do 300 tests per day. We will then look to further expand our AMI capability with sites that either do 450 or 300 tests per day.
Anything else you want people to know?
Barry, anything else we want? I think we're good. Okay, thanks guys.
Thank you.
Thank you, everyone. I'll follow up on that with